Welcome back, everyone. We are talking right now with Dr. Sean Southland, and he is the president and CEO of Neurohealth Solutions. We've been talking a little bit before the break, and you got to tell everybody a little bit about yourself. It's been a while, so like maybe a couple of days that you've been here, but tell everybody a little bit about yourself, what you do, but you are on a mission, and you have been for a while, but now even more so.
Well, like anything, being in healthcare, you want to respond to what's going on and help people continue on with their lives. Our group looks at infectious disease processes, and it's born from our staple kind of services, which is brain injury. So we do physical medicine, pain management, brain injury, the whole chronic disease process, slip and falls, if you have an infection, a neurological disorder and stuff like that.
Infectious disease.
And then, of course, yes, infectious diseases. So it's about being able to literally assess the integrity of your nervous system and then address it. So that's why this was a perfect marry to what we do. And it was, I won't say easy, but we found the service delivery model to help manage COVID-19 quite early, before all these deaths, unfortunately, which is terrible. And so we're still doing it, and that's what we do on an everyday basis.
Right, and you also have a website that people can go on and take an assessment, and you want people to do this no matter what, no matter where you think you are with it, whether, even if you're asymptomatic, people should take this test. Do you agree?
For sure, absolutely. It's, I mean, it's a good piece of information for everybody to see where they stand.
Right. And we've been putting this information out there for everyone because everyone should know this no matter what. And if you have any more questions, you can go further. They can call you. They can set up an appointment with you,
Absolutely.
Which you want to do. We want people to understand. You want to find out, you know, what, gosh, you know, maybe you have something on there that might be a level. I don't know what the different levels are, but maybe there's a level where you might be questionable of where you are. Don't just stop. Make that phone call.
Absolutely.
And have as somebody talk to you and tell you what you need to do, because you might need to go in, and what else happens?
Well, it's just a risk assessment and obviously practice. So if you have insurance, or I mean, we take private pay too, but you can just go over your risk factors, make an appointment, come in. And what we're finding is we've really been looking at the risk factors is just kind of the start. So we have people with like stroke problems, past strokes, or they're on meds for stroke prevention or cardiovascular, blood pressure. All the things you're on meds for, that doesn't mean the risk factor is gone. That's the problem that a lot of people I don't think understand. It's just because it's being, you have treatment for it, the risk factor is still there. COVID doesn't look at the symptom that you're, you know, kind of faking
Being
yourself
treated
out.
for it,
Yeah.
right.
It's looking at the actual risks, the physiological risks.
We're going to talk about that. This website is NHS for Neurohealth Solutions. So NHScovid19.com. Go up there, take that risk assessment. Please take it. Every person listening to this, you should also share it. I did, and I told other people about it, you know, because I know people, of course, outside of this too, of course, telling everybody on the radio, but I'm telling you right now, so important for you to take the test and find out where you stand. Again, that is NHScovid19.com. You can also call them, and I'm going to use this number here that I have here. It's 866-563-2682. You can
Absolutely.
call there as well. They'll talk to you. I'm going to go back into this real quickly because you just mentioned something. So many people out there that are listening, we are older folks. They're older folks.
Sure.
And they're all taking, you know, some sort of medication for something. What you're taking medication for doesn't cure it. It's not curing what you're doing either for whatever it is that you have. It's just helping you live longer, right?
Well, you get away with having the disease that you're living with, but you're not, you're basically treating the symptoms. And this is pretty well known with chronic management of disease in healthcare.
Right.
The idea here is to lower the risk markers. So when somebody comes in and they say, you know, I'm worried because I'm at risk for COVID-19, then we look and see, okay, well, what are your risk factors? And so we address the actual risk factors. What is going on physiologically? Inflammatory responses, oxidative stress, any types of markers that we can help reduce. Even simple things like cardiovascular system and cerebral vascular, so the quality of the blood flow in the brain.
So when they come to you and they, after they've taken this test, they call you now, they're having now an appointment with you, they come in. Each person is different, right?
Absolutely,
You know,
and that's another thing.
Go ahead.
The idea that the country is addressing everybody equally, that's not how this works. I mean, COVID attacks everybody individually, and everybody should be, you know, looking at preventative and proactive solutions based on their own, you know, lifestyle, based on their own past health indicators, and even their, you know, their lifestyle habits. I mean, if you have bad habits, you're going to be more at risk than somebody who eats healthy and gets plenty of rest and stays hydrated and has good, healthy choices in life.
And you have said many times while you're on the air with me is that it's all about being proactive with your health, you know, and not waiting. I don't think anybody should wait. And especially right now when you have the ability to take this risk assessment and just find out exactly, they're here to help you. That's all they want to do is give you the information so that you know how to be living a healthy life and not keep yourself from this as best you can, right?
Absolutely.
You have said it many times too. You believe that everyone's going to get it. I do too, because it's going to be a part of our lives. This is what I see.
Well, when the country's preventative measure is to not get it, that's pretty sad. I mean, there is no prevention out there except for let's socially distance ourselves and let's stay home. Well, that doesn't work, right? We're living beings. So in order to be human, we have to do something else, and that's find a way to deal with the things that life, you know, serves us. And this is the first time, you know, in my lifetime that I've ever seen our country hide from something that we can't control. I mean, you know, this is kind of interesting.
Yeah, it's been interesting to say the least, but main thing is I've had so many people that I know who've gotten hurt by it. You know, whether they got sick themselves. I know somebody who had their husband was in the hospital, they couldn't see him, he passed away. And he didn't even have COVID-19, it was nothing like that, but it was very sad. And
well, you
that's
just
another
touched
topic
on something. Yeah,
go ahead.
absolutely.
Go ahead.
The thing that's happening is people are not taking care of themselves on just a regular managed basis. So a lot of people that should be going in for screenings aren't doing it. A lot of people that might have the early stages of cancer are not finding them until they're in later stages. And I don't keep up with the numbers, but this is a time where all Americans, all people, need to take action and look inside and say, I need to be in charge of my own health. And we've made it quite easy because we take just about every insurance, and we try to figure out ways if people can't, you know, don't have insurances to help them get through it. But this is, again, if you don't engage in your own health care, you'll never have a system to fall onto, like a patient path for the exposure itself.
Before we go to a break, I want to say this because we're going to go to a break, and when we come back, I love talking to you. I love it because it's so interesting. But, you know, one thing I want to say to everyone, yes, we're opening up. We're open. Basically, everybody seems to be open. Doesn't mean that this is this has gone away and everybody should just act like everything's normal. We're going to go to a break. When we come back, we're going to talk further. Everyone, please go up on the website. It's so important, and tell everybody about it. We're live on Facebook. This is something that everyone should take no matter what. It's their risk assessment. It's nhscovid19.com.
Yeah.
So we're still live. So talking about that, you mentioned something that finding out that they had cancer almost later on stage.
Oh boy, yeah, this is happening a lot.
This man.
A lot of chronic management stuff. Oh, you have an actual patient or somebody you know that it happened to also.
Yeah, that's what I
Yes.
was say is that it was at he was at the Renaissance Festival and he wasn't feeling really great, whatever.
Right.
And he was perfectly fine before that. He didn't know anything, and that was what, March, and probably the end of March too. I don't remember when that is on. And they at first said that they thought that it was a sciatic nerve, but it wasn't, and it was a deep brain tumor. I don't know what they called it with a G. I don't remember.
Neuroma,
maybe
glioblastoma.
Yes, something like that.
Oh, that's not good.
And I don't remember the name. I can give it to you. And literally, he was in the hospital for 4 days, and they wouldn't let him see it. And he had a brain bleed.
Oh, yeah.
And then that was the end.
Well, let me tell you something. There's more deaths coming from the decisions made by politicians and people being scared than there is from actual COVID-19. Now, I'm not going to, minimize COVID-19. It is exacerbating multiple conditions, and it is the catalyst for a lot of deaths. More so, I think, than anything else currently. But of course, you have stuff that's been set aside, waiting until the last minute, which is why we came up with a care management system where you can be proactive. Of course, if you wait till the last minute, everything's overloaded. I mean, making decisions quickly when you don't have time and you're in a life-threatening situation, it's the trauma. I mean, going into doing rotations in trauma, you're talking about just walking in there, you have a 33% chance of not walking out. So just because it's immediate care that's needed and people have to make decisions right away. Well, COVID, it kind of, it totally does not follow any rules, and nobody knows exactly what it's going to do. So it affects everybody differently. But this is the time. It's hard to listen to politicians direct people's lives, especially when most of the time they are financially secure and they have the best health care possible. They're not speaking for the masses. They're not speaking for the frontline workers. They're not speaking for the 99.7% of small businesses that are trying to stay afloat, yet they're making decisions for other people's lives. So that's the part that I am totally not in agreement with. I understand we had to put measures in place to help people manage a chaotic time, but just saying, okay, let's hide from it and then slowly go back out. They still haven't put anything in place.
Right.
And I can go over yes, we have a lot of people, all this publicity about vaccines, but let's just look at historical evidence. We know, even if we have a vaccine, at the best, based on historical epidemiology, the best you're going to get is 60% of society that it works for. That's the best.
There we go.
If you even get one.
We're going to talk about that because that's kind of where we were.
What's that?
That's kind of where we were here on number 5.
Oh, yes.
Where I'm at. Here we go. So welcome back, everyone. We've been talking, and we stayed live during the breaks on Facebook, and so I love getting this information out because this is probably the more important information that we talk about here on. And I don't mean that to downsize anything because everything is important, but right
Absolutely.
now I think that people they're going to get a false sense of the security about, okay, so we're open, everything's going to be back to normal. It's not. Also, you talked a lot during the break a little bit about how people are dying more from what?
From not managing normal disease process. I mean, don't forget, we had a complete healthcare system that was working for managing all the other chronic diseases that were out there. And then we add this, and we shut down that system completely. Absolutely, completely. I get calls all the time. I just went to the Mayo Clinic. They're not going to see me because they want me to check and see if I have COVID-19. I can't go back in there until I get the results. Oh, they lost the results. Oh, 5 days later. And they're not going to see them. Now, I understand they're doing that to help protect the frontline workers because, again, we're waiting until the last minute, and then they're getting inundated. All the big healthcare systems are getting inundated with everybody. But we have this huge healthcare system that's run privately that was really the true backbone of healthcare management that totally shut down. And even us staying open, people don't know. They're like, are you still doing this? Are you not doing this? And it's like we immediately shifted because we could see immediately that we needed to put a care management system in place. And the breakdown was going to be that stopping of our healthcare system. And of course, what do politicians do? They did exactly what they shouldn't have done. But they did it, and now we have tons of money wasted, businesses going under. I mean, we're having a hard time, so, and we're working. You know,
Right.
so
And there are a lot of people that got hurt terribly. That it's just very sad that what has happened. Right, wrong, or indifferent. What your feelings are about this politically.
oh yeah.
I mean, it doesn't matter what they are. I just feel that it's terrible for people who passed away, the people who are hurting because they couldn't see their loved one in the hospital or go in the hospital, do things to get themselves better because they had to check, then they weren't taking the test at that time. I mean, it was really crazy. I want to talk to you about, so there's still no drug to treat it.
No, I mean,
No.
and there's not. I don't see a drug with the word drug. Okay, the closest thing we're going to get is a vaccine, hopefully. And if we do get it, it'll help some people. In the best case scenario, if you want to go by the epidemiology from the influenza virus, 60% efficacious or successful, but as little as 10%. And I think the average is in the 30 percentile range.
Will it be the same thing where you have that choice to take it or not? I mean, we're living in America,
Woo.
right?
Oh, boy. Yeah, absolutely.
I have to ask
No,
that because,
I've been thinking about that myself because I
as
have.
we're talking
Yeah,
about, I've never
for sure.
taken a flu shot, and I know people that took the flu shot that got the flu. So I'm like, I'm not taking it.
Yeah, absolutely. Well, that's a challenging one right now. I mean, I have a little boy, so and I have older children too. But I don't know that my son is going to be the first one in the trials to get the vaccine. If they're pushing let's look at a typical vaccine is proven after, I think, 5.5 years.
Oh, so not for a while.
So that's a typical vaccine. Okay, now we have all these amazing, resources going towards developing one. Okay, and I pray that they're successful. But historically, that's just, the odds are not on their side. Do you want to be the first one to try the vaccine? I don't know about that one. Okay, I'm not gonna. I just saw a thing about a lady who got arrested. She stole a vaccine from work because they were trying to promote it, and it had another something that was hurting people in it, but they were getting it approved. So I don't know all that stuff, and I don't want to get involved in all that. All I know is everybody should individually be proactive. They need to look at preventative measures, and the prevention is not a pill. Prevention is finding out what your risk factors are and going into your local healthcare provider. You can come to us. I mean, we have an office in Scottsdale, an office in Tempe, and you can find out what are my risk factors and what can I do to help reduce the chances of deleterious or negative side effects. But the reality of it is, unless you're going to stay locked away in a bubble for the rest of your life, and you can do it, hey, if you can do it, more power to you. But that's just not realistic. And if you want to try to get on with your life, it's time to engage in your own health care.
Right. And the first thing is go up on their website and take that risk assessment. You'll know where you stand. And please, we want you to, don't be afraid of it either. Maybe you have an answer there that says you might be at risk. Make that phone call immediately and make an appointment in their office. They have 2 office locations. You said Scottsdale and Tempe. The website is NHS for Neurohealth Solutions, so NHSCovid19.com. You can also call them. They'll talk to you. That's what they're here for. They want to help you. It's 866-563-2682. Going back over here. Hydrochlor...
Oh boy. Well, there's
I didn't
research.
need to get it out. That's okay.
Hydrochloroquine. Yeah, so there's research that shows that it blocks the mechanism of action from the infectious disease, the viral particle, from getting into the cell, the lungs, and doing the mRNA transcription. So, if there is validity there, then it would block it. So, nobody's saying for sure that it can be used as a prophylaxis, but some people are using it. If that mechanism of action is there, then great. However, there's one problem. It does have issues with damage to the retina, damage to the liver, and even death. So that's a problem with meds in general, right? We all know that. We see on TV, oh, take this new med, and then there's like 30 seconds and they speed it up, of all the things that you can die from if you take this one med. Again, we look at people from an individual basis, and we want to use good care management decision-making techniques that are both in concert with the patient, their medical history, and with the clinician. And that's why trying to manage in this on your own is not a wise decision. So even a lot of calls we get, we do telemedicine. You don't even have to come in because we're in Scottsdale, we're in Tempe. Let's say you call and you're on the west side or something. Maybe it's better that we just give you the telemed, consultation, and we give you some advice to go talk to your PCP, and they can put you down that path. But what we're seeing though is a lot of healthcare practitioners are not seeing patients if they think they might have COVID.
Because they don't want them in their office?
Yeah, for safety reasons, of course. But that's what we're here for. So,
right,
we can do outdoor, we do drive-through testing. We can do whatever you need if you want to drive to Scottsdale.
It's interesting because when I was younger, and I don't remember what it was, I had, maybe it was mono. I don't remember what it was.
Sure.
But
reduced immune system.
I had to go to the doctors, and I was younger. It might have been junior high school.
Oh, and then they treated you like, hey, wait a minute, stay away from me.
But they put me in the back, they brought me in the back room. I mean, there was a way of getting in. In those days, they didn't have the telemedicine. They didn't have any of that.
Right.
I mean, I still had to be seen.
Absolutely.
I had to go around the back door, and I was seen back there.
Yeah.
But at least I was seen,
Right.
And I think this is what I think is terrible is that
it's just about communication. And then, of course, if you think you might have something, then wear that mask. But again, that mask, I don't even know what to say about the mask. I mean, if you cough in the mask, you're still going to have viral particles that go out. You're still breathing. But it is going to help. I mean, hopefully reduce. If I'm wearing a mask and you're wearing a mask and we're in the same vicinity and we might think one of us has it, then of course,
right.
That's
I think people should still at least wear the mask when they're out. At least do something.
Right. If we're going to now make the rest of our lives where we're wearing masks,
I think
because we're not willing to look at our own risk factors and boost. It's like, okay, I'm going to wear a mask. I'm going to stay away from everyone from the rest of my life. Or can I just look and see what my risk factors are?
Right.
And what are the odds that, I can deal with this or not deal with this? And how can I put myself in a better position to deal with it? How can I fortify my immune system? So until we start taking an active role in that, letting somebody else dictate your health is probably not a good thing. I don't know anybody who's going to be more worried about themselves than themselves.
Right, but here's the thing: sometimes as the people, we put our heads in the sand,
Yeah.
And for some reason, people want to think that they can get through this without, getting hurt. It is all about taking care of yourself. What are your final words today?
Be proactive and go to nhscovid19.com. Give us a call, set up a telehealth conference if you want, and just be an active member of your own health and your family's health.
Absolutely. It's all about that. This isn't just now. This is before, now, and afterwards. We should always be in control of our own health. And being healthier people in general. Let's face it, America, we're not that healthy people. But you know something? You can be. The first thing to do is get up on that website and tell everybody about it because it's awesome. Okay? It is NHScovid19.com. You can also call them. They'll do a consultation with you, even telemed if you want. Again, that's 866-563-2682. Take the test. It's NHScovid19.com.